Hello, everybody. Welcome to week 7 for our first year clinics. Updates for you and kind of reminders this week. So first on the patient tracker, a reminder that the initial scale errors are all a -1. Rescale errors, though, are a -2. So if you go back in and they haven't removed the deposit, you're going to give them a -2 in the rescale area. I'd also like you to be keeping an eye on staining. Sometimes this gets missed because we're so focused on calculus removal, but during the polish check, if you see that any staining still remains, please instruct students to probably use an instrument to remove any remaining stain. Also, another reminder for you is the Carey's risk form. That goes low, moderate, and high for risk. And it's just based on where the check marks are. So if they had, a couple marks in low, and then they have several marks in moderate, nothing marked in the high risk category, that is a moderate risk patient. So they wouldn't bump up to high risk unless they had an actual check mark in the high risk area. Same thing for moderate. If they only had things marked in the low column, then they would be marked as low risk for Carey's. For our dentists, please, if the students need to take an FMX and you feel that the patient would qualify, please allow those. The patient should need to be 18 and over to take the FMX. But if they can do that instead of the pan and 4 bite wings, if you feel the patient meets the criteria, please do allow those to go through so the students can meet those requirements. Again, assuming it's acceptable for the patient. It still needs to meet the 3 to 5 year guideline, etc. I have a training video for you this week on mounting the Typodont, the chair mounts. Even if you have mounted those in the past, I do suggest that you watch the video. You might find some helpful tips on there. I'm going to host a SARP calibration tomorrow night. That's Tuesday, February 24th at 5:15 p.m. And I'm going to go over how to complete the SARP evals. So I think that'll be helpful whether you are a new or a seasoned faculty member. If you can't make it, it is totally fine, and I understand. I will get it recorded and I will send it out so everybody does have access to that. And then after we finish the calibration, we can stay on if anybody wants to talk through or troubleshoot anything in clinic. We did find that to be really helpful after our last first year meeting. So that is an option as well. The next set of skill evals that I think you're going to see coming through are for the instruments. Those are due week 9. So those will probably be ramping up over the next couple weeks. I did put some tips for completing those on the Google newsletter. So I'll be sending you that link in an email. And if you get a chance, kind of read through those. It might help you as you're working through the instrument skill evals. Otherwise, that's all I have for you. I hope you have a wonderful week. If there's anything you need, please do not hesitate.